Now, your situation is different than some of your colleagues in a material way because you yourself got sick. You yourself have been infected with COVID-19 and survived it and recovered. I imagine that the idea that you may have immunity to getting further to being infected again must change your whole mindset in terms of how you're approaching your job now.
This, again, a great point. This is the reason I felt that this was an important message, because there is no good way to describe the amount of anxiety a healthcare worker such as me, or the nurses, the environmental service worker that comes to work, the unsung heroes of this hospital and of medicine in general. There is no way to describe the fear and the anxiety you would have of coming to work, knowing that there is a disease out there that's an invisible disease that may actually take your life. I've never served in the military. The closest I would ever come to serving in uniform for this country is to do the job that I am doing today. And by that I mean, I liken it to listening to the whistle as you go up over the trenches to face the enemy bayonet. That nervous fear that you would have to know that to do my job, to save lives, to follow my calling, it may take my life, but yet people show up to work. The degree of selflessness that people have demonstrated have really been reinvigorating for me, for my profession, and why I do this. I stand on the shoulders of giants, and I stand alongside the most fearless people I've ever seen.
Dr. Prakash Gada, surgeon at MultiCare Tacoma General Hospital in Washington. Sir, thank you for your work, and thanks for taking time to talk to us about it. I really appreciate you doing it. I hope you'll stay in touch in these coming days and weeks.
Thank you, Rachel. This is a great honor. I appreciate it.